Tonight about Kentucky's first confirmed case of measles in more than a year. Dr. Stephen Stack, commissioner of Kentucky's Department for Public Health, says the patient is recovering. The case involves someone in Franklin County who recently traveled internationally. The person may have unknowingly exposed people to the highly contagious virus at the Planet Fitness in Frankfort. So far, Dr. Stack says no other cases of measles have been reported, but he says we're not in the clear just yet. More about this in tonight's look at medical news.
At this point, we're not aware of anyone else who has become infected. But remember, we just announced that case within the last week, and it takes 8 to 12 days for exposed people to develop symptoms. So we are only really now just beginning to get to the period of time where it is possible we could see others. Measles is possibly the most contagious human virus on the planet at present. You can have one person with measles is likely to infect at least 18 other people. If someone with measles were to sit in this room with us for a short period of time, you could presume that you would have the risk of getting infected walking through that air for up to 2 hours after they left. Very, very contagious. The most common things are you have cough, you have a runny nose, and you have red, watery eyes. You can develop a rash on your face. It's kind of a fine red looking spots or rash. It starts in your face and spreads to the rest of your body. And sometime a few days into the illness, you can develop little white spots in your mouth called Koplik spots. The MMWR vaccine, the one that we give to children, is incredibly effective. It's one of the most effective vaccines, in fact. If you get 2 doses like we recommend, and children are recommended to get their first dose at about 1 year, and the second dose at kindergarten age, about 4 to 6. If you get those 2 doses, you have a 97% prevention rate. So meaning that you have less than a 3% chance of getting measles, even if directly exposed to it if you have 2 doses. If you only have 1 dose of the MMWR vaccine, you have a 93% prevention rate. If you are immunized, or if you're over 70, or if you served in the U.S. Armed Forces, you do not need to worry about this for yourself. You are very protected, and you should walk around in confidence that you are very safe. There's never a guarantee, right? There's always the uncommon or the rare case that's sad, but you should generally feel that you are safe. If you are unimmunized and you are exposed to someone with measles, you should presume that there's a very high risk you will get infected. Because measles is so contagious, we have to have 95% or more of a community vaccinated against it in order to prevent its rapid spread. And immunization rates have decreased. So in Kentucky, for example, in 2019, we were at about 93% of kindergartners who were immunized fully for measles. That fell to about 88% during the COVID pandemic. It's now back up to 90%, but it's still significantly short of the 95%. As a physician, I think I've probably conservatively treated 50,000 people in my clinical career. I never had a person come in with appendicitis and say, it's a natural thing, I'll just go home and die. I never had a person with breast cancer say, it's a natural thing, I won't take chemotherapy and radiation therapy and try to keep myself alive. It is a sadness for me as a physician that these immunizations that many billions and billions of human beings have taken for many, many decades with great safety and that have nearly eliminated some of these diseases. It's a great sadness for me that unfortunately there's this counter narrative in society that immunizations are somehow unnatural or not safe, when in fact the illness is so much more dangerous.